Welcome and thank you for joining me for this brief lecture on skin cancer. And I'm calling it an epidemic that we can fight. This is something that if we learn about it, we can do all kinds of things to protect ourselves and learn how to recognize the risks. Who am I? Well, my name is Raylene DeVilliers. I'm a certified medical assistant through the American Association of Medical Assistants. I have a bachelor's of science in healthcare management. I've worked for more than 30 years in healthcare, including 6 in public health and 4 in dermatology. And I have about 8 or 9 years of teaching medical assisting, phlebotomy, billing and coding, computers, and management classes in a few different proprietary schools. I'm also a former member of the Dermatology Nurses Association. The learning objectives for this lecture include the following. List the 3 most common types of skin cancer, identify skin cancer risks, and discuss skin cancer prevention methods, and then differentiate among different treatment options for those types of skin cancers, as well as using the ABCDE method recommended by the American Academy of Dermatology that helps you to remember a way to list the warning signs of malignant melanoma. Here are some scary statistics. 2 million new cases of skin cancer are diagnosed every year in the United States. 1 in 5 Americans will develop skin cancer in their lifetime. And this can be a variety of different types of skin cancers, from the easiest treatable basal cells to the most severe malignant melanomas. 1 American dies every hour from skin cancer. That should be pretty shocking. Tanning beds increase the risk of melanoma by 75%. And melanoma is the most common form of cancer in young adults ages 25 through 29. That's of all types of cancer, melanoma is the most common. Sun exposure and indoor tanning cause premature aging of the skin, which may not sound like a huge deal, but most people are very conscious of their looks, and so having skin that ages prematurely can have a big impact on someone's life. So the first one we'll talk about is basal cell carcinoma. This is the most common type of skin cancer overall, but it's very preventable. It appears on sun-exposed skin, and risk factors include light-colored hair, skin, and eyes. So very fair-skinned people with light-colored eyes, green or blue, they are going to be the ones, redheads, blondes, they'll be the ones that are at the highest risk. And what you look for are sores that bleed, then heal, but then come back again. And scars that feel kind of waxy. They may be skin colored, they may be pink, white, yellow, or a combination of any of those. And lesions that have a pearly appearance, if you look at it in certain light, it does have kind of a shimmery appearance to it, like a pearl. And they all have little tiny blood vessels that feed the lesion, and those are called telangiectasias. And there is an arrow there that points to the basal cell. You can see the telangiectasias there on that cancer. Squamous cell carcinoma, not squamous, but squamous cell carcinoma is the next one we'll talk about. It's also very common, but highly preventable. It appears where the skin has received a lot of sun, especially over a long period of time. So your risk factors are long-term sun exposure, exposure to some types of chemicals. Some people who drink well water may be exposed to certain chemicals, well, not chemicals, but minerals in the ground that can cause it. And then exposure to UV or ultraviolet light and other radiation can also cause squamous cell carcinoma. What you should look for, there's a good picture there on the tip of the top of the ear at the very tip. Scaly, crusty bumps or patches, open sores that itch and bleed. Maybe you bump them on things and that will kind of knock the little scabbed area off of it and make it bleed quite a bit. Scaly patches on the lip. Sometimes the skin on the lip can become very thick And then early detection for this type of skin cancer can really help to minimize scarring. What that means is the earlier you catch it, the less excision or treatment area will need to be done there, and that can actually produce a much less visible scar. Then we get to the bad one, malignant melanoma. This is a deadly form of skin cancer, though it's often considered highly curable when it's diagnosed early, and that's the key. This is sometimes harder to diagnose, especially if you don't think that you are at risk for it. So you may not necessarily seek out help or treatment if you aren't aware of what the symptoms are or the signs are. So that's why I'll go over these with you. They may appear in areas where you've never had any sun exposure. There have been many cases where people have them, like, in bathing suit areas that are covered by the suit, and or in other spots that have never seen the sun, like in internal organs. And risk factors include at least one severe sunburn during childhood or adolescence, genetic predisposition, and a history of what are called dysplastic nevi, or bad moles that can turn into cancerous lesions. Now, the moles that we're talking about here are not normally the ones that are flesh colored and stick out above the skin. Typically, a melanoma is going to look more like a flattened area, a very dark freckle. It may start out small, but typically they're pretty dark, and they just kind of come up suddenly. You start noticing them. What you look for: moles that have changed color, shape, or texture. A flat mole that suddenly becomes bumpy is probably something that you should have looked at. If you have dark streaks under your nails, they may be something as simple as a bruise, but they could be a melanoma in the nail bed. Lesions that are dark or irregularly colored, and by that I mean they could have brown, black, blue, red, yellow. They could have just a huge variety of different colors in them. And the more colorful they are, with many different colors, the more at risk it is for being a melanoma. And also moles or lesions that are not uniform in their appearance. So if you looked at the two halves of it, they would not match up. Okay, so the next thing we'll talk about is A, B, C, D, E. This is an easy way to remember what some of the different ways that you can look at a mole and think, is this something I should have looked at? So asymmetry is the first one, meaning, like I said before, the two halves of the mole do not match up. They're asymmetrical. The border is often unusual. It can just look strange. It's not going to be a nice round border. The color can be very dark, but there have been melanomas that are very pale and may even look white. The diameter is going to usually be larger than that of a pencil eraser. And then E for evolving. This is a mole or a dark spot or any type of a spot on the skin that is not remaining the way it always looked before. It's started to change. Maybe it's brand new. Maybe it's something you've had for a long time, but it's starting to look different. And then we come to treatments. Well, there are different treatments for different types of skin cancer. For basal cells, or BCCs, the most common treatments will include curettage and electrodesiccation, often called C&D or ED&C. And with this, the area is numbed with a local anesthetic, just a small amount that's injected underneath the skin, and then it's scraped with a curette and burned with electricity. And that electricity is it's a small amount, and it's just enough to cause damage to the tissue. And then another way is by surgery, either by regular excision or by Mohs micrographic surgery. And that one's very popular these days. It's often used because it's considered tissue sparing. An excellent treatment for noses, for lips, for ears, or around the eyes, other places on the face, anything that you would want to have a good cosmetic result. Cryosurgery is another possible treatment. This uses liquid nitrogen to freeze and destroy cancer cells. And then there's topical chemotherapy with a product called 5FU. And this can be used for basal cell, but it can also be used and often is for precancerous lesions. So those are areas on the skin which they often called actinic keratoses, and they are damaged areas of the skin, but they have not yet turned into a skin cancer. And the 5FU can actually destroy those cells before they become cancer. Okay, to go on to treatments for squamous cell or SCC. Most common treatments are going to be very similar or exactly the same as those for basal cell. However, if the cancer cells have spread beyond the skin, then generally other therapies have to be used, including chemo, targeted therapy, immunotherapy, and even radiation therapy. Finally, for malignant melanoma, the biopsied lesion is staged, and what that means is you're going to look for the thickness of the lesion, how deep into the skin does it go, and evidence that cells have spread to other areas of the body or even just have spread into a wider area on the skin. The stage of cancer informs the treatment options available. So that means that depending on the stage of the cancer, maybe it can be completely treated by removing it with a wider excision, just taking out more cells in that same area. But sometimes that's not enough and they have to go further. A stage 1, that has the best prognosis. This is when cancer cells have not metastasized. They have not migrated any deeper or wider into the tissues. And stage 4, that's the most serious. And that means that the cancer has spread to other organs. There have been cases of malignant melanoma in the brain, in the heart, in just any tissue in the body is where it can go. Surgery is often followed by radiation, chemo, targeted therapy, immunotherapy, or even a combination of several methods. And of course, that's all going to depend on how that cancer is, where it comes out in the staging. So what do you need to do to protect yourself from skin cancer? Well, there are a couple different things. The first one is avoid or at least limit your sun exposure between 10 a.m. and 3 p.m. Cover your skin, use long sleeves, hats, and umbrellas. Use a broad spectrum sunblock, not sunscreen, with an SPF of 30 or higher and reapply it frequently. That means sometimes, once an hour, depending on how long you're outside and whether or not you're in water or there's a lot of wind or you're wearing, putting things on and taking them off again that might rub some of it off of you. Get regular skin exams and also know your family history. If there's a family history of skin cancer, you are at higher risk of skin cancer. So let's review. Which of the following is the most common type of skin cancer overall? Is it malignant melanoma, squamous cell melanoma, squamous cell carcinoma, or basal cell carcinoma? Well, I think we know the answer. It's basal cell carcinoma, or BCC. Very, very common skin cancer. Most people are either have had it themselves or they know someone in their family that's had it. It's not a scary diagnosis. It's usually very easily treated, sometimes even at the same time that the biopsy's done. More review. What are 3 ways that you can prevent skin cancer? Well, we just talked about it. Cover up. Use hats and clothing to protect your skin. Use sunblock and reapply it frequently. And avoid prolonged sun exposure between 10 a.m. and 3 p.m. So if you have to do yard work, try to do it before 10. Avoid those sunbeds and any tanning bed at all. The idea of having a healthy tan is a misnomer. That's just not possible. If you want more information, please look at this screen. I've got 3 different places where you could go to get more information, including the American Academy of Dermatology, Centers for Disease Control and Prevention, and also the Cancer Information Network. And that concludes my presentation. Thank you very much, and I hope you enjoyed it.